equity is about who has a seat at the table. In the work that I do, youth voice is critical to the changes we're trying to create in programs, systems, and policies. If you leave here learning anything today, just know that we all play a role in creating a healthy, equitable society, and that your voice, your perspective, your lived experiences are so important to shaping that work and deserve to be heard and centered.
As an example of an organization that is focused deeply on supporting youth, La Puerta Abierta provides no-cost counseling and mental health services to Latinx community members who are uninsured and who cannot afford private services. As part of their programming, LPA provides school-based peer support groups to newcomer immigrant youth who have recently arrived in Philadelphia. Some of you may have personal experience with migratory journeys, while others may have lived in Philadelphia since birth. In either instance, if people are living in a place that does not understand you as a person and might not have the time or the desire to learn about what you want, connecting with others who share your experience and who can offer friendship, acceptance, and advice provides a powerful source of healing, helping to break down those barriers. Another organization supported by Philadelphia Health Partnership, the African Family Health Organization, provides an after-school African Youth Empowerment Program. This program creates a safe environment for young people to connect for mutual support while receiving mentoring from tutors recruited from area universities, many who are also African and Caribbean immigrants themselves.
What we really do could be split up into two camps. So first is thinking about clinic-based interventions. So the idea is that a patient comes to the doctor's office, they are experiencing hunger, them or their families, they're experiencing housing instability, they're living in poverty, they're unable they're having trouble getting to their doctor's appointments because of transportation issues. And so what we think about is the ways that in the clinic, within the hospital, we can assist this patient to getting the care that they need, getting the help that they need in order to improve their long-term health. The second kind of major way that we think about social need and the social determinants of health is outside of what people typically think of as healthcare. So this means addressing poverty. It means addressing hunger through systems that are different than the healthcare system.
Focusing on what the City of Philadelphia has to offer, they have a youth commission which engages young people to advise the mayor, city council, Philadelphia schools, and other decision makers, and to comment on legislation and policies that impact youth. You might have heard about this group, and if you haven't, you should consider participating as an opportunity to raise your voice and to be heard. Speaking of being heard, ensuring that youth voice and leadership are at the forefront of defining what health equity means to you is critical. The Village of Arts and Humanities in North Philadelphia is one such organization that provides youth development programs in which youth and adult mentors come together to identify and study socioeconomic challenges in Philadelphia neighborhoods and to explore how local issues connect to the city, the country, and the world. Participants utilize creative research methods like oral interviews, social justice photo booths, a story circle, to gather ground-level information from those most affected by community and social challenges. Youth then use art making to illustrate and share collected data and to propose solutions or responses. For instance, in one upcoming project, youth will have an opportunity to interview residents of a public housing development that is soon to be renovated to document their histories and to share their priorities for the future of housing in their neighborhood. These are just a few examples of what is happening in Philadelphia and how individual organizations approach health equity in different ways.
So going forward, I think that we really need to address the deep roots of these disparities, including racism and intolerance. Improving health equity is going to require massive change on many fronts, so certainly it's not a small lift. But if there's one thing I would emphasize, it's really the importance of letting people who are impacted be the drivers of change. So it's community members, patients, and in your case, youth themselves, who know better than anyone the challenges that need to be addressed. You're going to know best your own sources of strength and resilience that outsiders, in your case adults, may often overlook, and you're going to know best what solutions are the most likely to be successful. I truly believe that if we're going to make progress in improving health equity, we need to recognize that people with lived experience, those who have gone through challenges firsthand, are experts. We need to ensure that you, are listened to and respected, and to ensure that you're always at the table when decisions that would impact you are being made, and that you're there from the very start.
In closing, I can't emphasize enough that your voice matters, and people are starting to listen. Speaking for everyone at Philadelphia Health Partnership, we are here to listen and work to support your path to well-being.